Well, Jeanette has done a great job of keeping us up to date on the pollen counts across San Antonio. And as she's pointed out, it hasn't been great in recent weeks. It's springtime and it comes with a lot of seasonal allergies that affect many of us. So we invited Dr. Chioma Udemgba to join us in studio. She's an allergist and immunologist with University Health. Doctor, thank you so much for being here with us. So you were telling us this year in particular has been worse than years past. Why is that?
Yes, so we've seen over the past couple of years as our global temperatures have risen, as pollution levels have gotten higher, we've seen increases kind of globally with our pollen counts, and that's unfortunately affecting a lot of San Antonians as well as other people across the state.
And for some reason, allergies or pollen in general, those things love to settle in San Antonio. Why is it? It's because of our topography, right?
Yeah, so one bit of it is topography. Another piece of it is also just the type of trees that are living here and growing here. And so a big part of what we're feeling right now is an aspect of tree pollen season. And this is a map that is showing us that juniper trees, which are cedar trees, they have a big concentration in central Texas, and so as they pollinate, they're releasing those pollens that's making a lot of people feel terrible.
And sometimes when people start feeling the coughing, sneezing, watery eyes, we should try to treat those right away because they could turn into something much worse, right?
Yeah, absolutely. So histamine that's being released is making you feel terrible, so taking an antihistamine as early as you can is going to be what helps with your symptoms. But the more histamine that gets released, the more antihistamines you'll need, and so it's going to take you longer to feel better if you take too long to start taking those medications.
What do you think about people setting an alarm on their phone? I know that my daughter's doctor, she's at really bad allergies, has said to set an alarm on your phone for March 1st every year to start taking those allergy meds to try and start getting them working in your body.
Yeah, so you'll see a trend. You'll know that, okay, every year, most of my patients will say, every year, January, February, I feel terrible. Okay, so 2 to 4 weeks before that time period is when you should start taking your medications. Another great way to kind of keep track and know when to start is by tracking the pollen levels. You'll start to see them go from the low level in the green to the yellow to the orange, and then red is when it's terrible. So start when things are kind of creeping into the yellow, creeping into the orange.
And you mentioned maybe even wearing a mask, right? Can help get the stuff from you breathing it in.
Yeah, absolutely. The biggest part of treating your allergies is avoidance. So if you can try to avoid the pollen, you can start to feel better. So that means wearing a mask to help filter out those pollen particles, using an air purifier to pull it out of the air, keeping the windows closed when you're driving so that, again, that pollen isn't making its way into where you are to make you feel so uncomfortable.
Any particular times of the day that maybe kids or adults should avoid to kind of not get the stuff on you?
Yeah, so early morning and midday is when pollen levels are going to be the worst. So if you can try to reduce your time outdoors during that period, it's going to be great. So if you're a morning walk person, maybe let's do your walks in the evening during the peak of the pollen season.
And wash your hair, right? Wash your hair, wash your clothes every time when Jeanette shows that big graphic of the high count of pollen and stuff.
Yeah, and I tell people you also have to think about your pets because they're going outside on your walks with you. They're bringing that pollen into the house and on the couch. So wipe yourself down, wipe your pets down, change your clothes so that you're not sitting and breathing in that pollen while you're inside in your safe home.
All right, well, thank you so much for all the great tips, Doctor. Thank you for stopping by. We, of course, will have much more on this on news4sanantonio.com. We'll be right back.